A needle that costs pennies can save millions. The fact that in 2015 federal funding is still banned for needle exchange and 25 states still require people to get a prescription to buy needles is an outrage, both from the human and from the economic perspective. But what's even more frustrating is that politicians and many journalists still see needle exchanges as controversial, when the data on their safety and efficacy is actually stronger than for virtually any other public health intervention, including condoms. Even a quarter century ago, I didn't need to rely only on anecdote to make the case. By 1986, the scientific rationale for providing access to clean needles to prevent the spread of HIV was already so strong that in the UK, Margaret Thatcher's Conservative government endorsed it, creating and funding pilot needle exchanges where needed. At least in part as a result, Great Britain prevented a national epidemic in for drug users. Before syringe exchange was fully expanded in the UK, however, the town of Edinburgh in Scotland provided an early warning of what might happen if it was not. A 1987 police crackdown on needle possession yielded a 10% rise in HIV rates in addicts there. But after 6 months of needle exchange, there was no further increase. By the late 1980s, expansion of needle access had occurred in countries ranging from the UK and the Netherlands to France and Australia, and in none of those cases was the policy accompanied by an increased number of drug users. In fact, the Netherlands saw more people seek treatment, and most injectors using exchanges actually injected less than those who didn't.